Hi, welcome to the U.S. Open. I'm Dr. Robert Parisian, orthopedic sports medicine surgeon at Mount Sinai, and I'm a player physician here at the U.S. Open, providing courtside coverage to the players. One thing I want to discuss today is hip and core injuries and how they, what the most common types are in cutting, pivoting activities, especially with tennis. When we think about hip and core injuries, think about our hip flexors. Hip flexor injuries are very common, strains and pulls of the hip flexors, as well as the groins. You can have many groin pulls. With that lateral activity, you're really stressing those adductors and those groin muscles. Moving out to the outside of the hip, you can have some abductor injuries as well. And really, it's really strains that are the most common types there. Now we move up to the core, you can have a core muscle injury. Now we've seen that in recent tournaments with some athletes, and we'll see it throughout this tournament as well. And so core muscle strains are very common as injuries as well. Now, beyond strains and pulls of muscles, you can also have something called hip impingement. And impingement is when the ball of the hip joint abnormally contacts the socket. And that's happening really deep inside the joint, and that presents as groin pain. And that's something that some of these athletes may be dealing with throughout the tournament. So we're here to address any of these injuries during the next few weeks at the U.S. Open.